Welcome! In this video, we'll quickly explore the key features of the hip bone, including the pubis, ischium, and acetabulum. Let's get started. Sacropelvic surface. This is the uneven area on the inner surface of the ilium, situated behind its medial border. It is subdivided into three parts: the iliac tuberosity, which line just below the dorsal segment of the iliac crest; the auricular surface, which articulates with the sacrum to form the sacroiliac joint; pubis. It is the antero-inferior part of the hip bone and consists of three parts: body, superior ramus, and inferior ramus. Body of pubis. It presents the following features: pubic crest, pubic tubercle, and three surfaces: anterior, posterior, and medial. Pubic crest and pubic tubercle. The pubic crest is the thickened upper border of the body of pubis, and its lateral end projects forward to form tubercle, called pubic tubercle. Superior ramus. It extends from the body of the pubis to the acetabulum, above the obturator foramen. It has three borders and three surfaces. The superior border is called the pectineal line, or pecten pubis. The anterior border is called the obturator crest. The inferior border is sharp and forms the upper margin of the obturator foramen. The pectineal surface is a triangular area between the anterior and superior borders. The pelvic surface lies between the superior and inferior borders. It is smooth and is continuous with the pelvic surface of the body of the pubis. The obturator surface lies between the anterior and inferior borders. It presents the obturator groove. Inferior ramus of pubis. It extends downward and laterally from the lower part of the body of pubis to join the ramus of ischium and form the conjoint ischiopubic ramus. Ischium. It is the thick postero-inferior part of hip bone and consists of a body and a ramus. Body of the ischium. It is very thick and lies below and posterior to the acetabulum. It presents two ends, three borders, and three surfaces. The upper end forms the postero-inferior 2/5 of the acetabulum. The lower end forms the ischial tuberosity. The anterior border forms the posterior margin of the obturator foramen. The posterior border is continuous above with the posterior border of the ilium. It also forms part of the lower border of the greater sciatic notch. The lateral border forms the lateral margin of the ischial tuberosity, except at the upper end where it is rounded. Surfaces are femoral, dorsal, and pelvic. Conjoined ischiopubic rami. The inferior ramus of the pubis unites with the ramus of the ischium on the medial side of the obturator foramen. The conjoined rami have two borders, upper and lower, two surfaces, outer and inner. Acetabulum. It is a deep, cup-shaped hemispherical cavity on the lateral aspect of the hip bone, about its center. It is directed laterally, downwards and forwards. All the three parts of the hip bone contribute in its formation as follows. Pubis forms its anterior 1/5. Ischium forms its posterior 2/5. Ilium forms its superior 2/5. The margin of the acetabulum is deficient inferiorly. This deficiency is called the acetabular notch. A horseshoe-shaped articular surface, or lunate surface, is seen on the anterior, superior, and posterior parts of the acetabulum. It is lined with hyaline cartilage and articulates with the head of the femur to form the hip joint. Thanks for watching. For more easy-to-understand anatomy videos, subscribe to Little Bit Healthier.